Thank you for joining us today for this Medicare webinar series and today's topic, Medicare, Medicaid, and other health insurance options, what you need to know, presented by the Pikes Peak Area Agency on Aging. We would like to thank the Park County Extension, Park County Senior Coalition, Seniors Alliance of Platte Canyon, and our hosts for their support of this webinar series. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation. Use the raise hand function or the chat area to let us know that you have a question. And now it is my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging.
Thank you, Jared. Good afternoon, everyone. Thanks for joining us for our part 4 of the 4-week series on Medicare 101. Appreciate you guys hanging in there for this entire series. Hopefully you guys are not getting inundated with weather yet. So today is our last presentation of our 4-part series. And as Jared mentioned, we're going to be talking about Medicare, Medicaid, and other health insurance options that might be available to someone who is aging into Medicare or becoming eligible for Medicare. As always, I like to start with who I am with, which is the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. The mission of the Area Agency on Aging is to work with our partner counties, Park, El Paso, and Teller, to develop systems and programs that allow people to stay in their homes for as long as possible. This is in partnership with the Colorado State Extension Office, the Senior Coalition, and Seniors Alliance of Platte Canyon, and we appreciate their partnership for sure. Again, I am with the State Health Insurance Program, which is a federally funded program designed to provide free and unbiased information and education on all things Medicare. The office here in Colorado Springs actually covers a total of 9 counties in Colorado. This is a federally funded program, so every county and every state should have access to a SHIP program or a SHIP counselor, if nothing else, by statewide toll-free number. I've listed both our local Colorado Springs number as well as our statewide toll-free number on the slide. Just a quick review of the topics we've covered so far. In week 1, we covered eligibility, enrollment, benefits, and costs of both Original Medicare's Part A and Part B. In week 2, we covered the specifics of Medicare supplements or Medigap and Medicare Advantage plans, sometimes referred to as Part C. And last week, we covered Medicare Part D, D for drugs, the newest benefit of Medicare for prescription pharmacy drugs. So tonight we're going to kind of cover everything else that might be an option available to you, including employer coverage, retiree coverage, military retiree coverage, Medicaid, and the marketplace. As Jared mentioned, I am always open to taking questions throughout the presentation, so I'll pause at the end of each section to see if anybody does have questions. When I pause for questions, you're welcome to simply unmute and ask your question, or you're welcome to raise your hand, or you're welcome to type a question into the chat at any time, and I will address them at the breaks. So let's get started. This will be short and sweet. So we're going to start with employer coverage. So there are many people who are working past age 65 in Medicare eligibility. And as I've mentioned before, in many times, if you are still actively employed and have health coverage through that employer that's covering you and or a spouse, and that employer has at least 20 employees, you would be allowed to delay enrollment into Medicare in favor of that employer health coverage. And you could enroll in Medicare anytime while you're still working and covered under that employer health coverage, and up to 8 months after that employer health coverage ends. That 8 months is that special enrollment period. If you continue to work and keep your employer health coverage, you can also enroll in Medicare A and B. Social Security does encourage people to enroll in Medicare Part A if you're entitled to Part A at no cost, simply because it's at no cost. If you go ahead and enroll in either part of Medicare while you're still actively working and covered by employer coverage. Keep in mind that Medicare will become secondary to the employer coverage. Again, you must work for an employer with 20 or more employees. So Medicare would become secondary, whether you enroll in A or both A and B. Once that employment ends, if you go ahead and enroll in Medicare, so for example, if you enroll in Medicare Part A only, when your employment ends, you will still have that 8-month window, that special enrollment period to enroll in Part B without penalty. But again, you can also enroll in any part of Medicare while you're still actively working at any time, which allows you the ability to coordinate your coverage. So if you are still working and then you know exactly when you're going to stop working or you're going to retire, you can make sure you coordinate your enrollment into Medicare, either part of Medicare, so that as soon as the employer coverage ends, Medicare starts the next day. But again, if you enroll in both A and B, when that employment ends, you wouldn't have to worry about enrolling in Medicare, and you will have a special opportunity to enroll in either a Medigap or a Medicare Advantage plan or Part D. Those windows of opportunity are much shorter. So you'd only have 2 months to enroll in a Part D. You'd only have 3 months to enroll in an Advantage plan, but you would have up to 6 months still to enroll in a Medigap or Medicare supplement. Keep in mind that if you do continue to work, the employer cannot require you enroll in Medicare. They cannot entice you to enroll in Medicare. They cannot incentivize you to enroll in Medicare. They must treat you as if Medicare did not exist if you're still actively working. If they were to do that, that is honestly against the law, and it would certainly be something I would encourage you to speak up about. There are a lot of people who will continue to work all the way up to almost age 65. Whether you stop working prior to age 65 due to layoff or retirement, or you just decide to stop working, you're always given the opportunity and the ability to enroll in what's called COBRA coverage. COBRA stands for Consolidated Omnibus Budget Reconciliation Act. Basically, it's continuation coverage, and it provides you a continuation of your employer coverage even though you're no longer employed. The downside to COBRA coverage is that you will now start paying the full monthly premium for that benefit. And if you're covering a spouse or dependents, you're going to pay the full monthly benefit for them as well. But it is required by law that you're provided that opportunity. So whether it's due to end of employment or even a reduction in hours that no longer make you eligible for the health insurance benefits through the employer, the employer's required to offer COBRA coverage so that you are not uninsured. It is also possible to extend COBRA coverage just to a covered spouse or dependent child who's been covered under your employer benefit. And that is in some specific situations. So for example, if you are employed, you stop working, you're not age 65 yet, so you're not quite eligible for Medicare, you get COBRA coverage. It covers you, your spouse, and or your dependents. If you become eligible for Medicare, you have to enroll in Medicare. But your spouse or dependents could continue with the COBRA coverage because they're not eligible for Medicare. They could also continue with COBRA coverage if you are divorced or become legally separated. They can continue COBRA coverage if you pass away as the employee. They would still be able to have that COBRA coverage. Or if there's a loss of dependent child status. So if you have a dependent child and they age out, they turn 18 or turn 26 if they're still in college. So COBRA coverage is basically designed as a stopgap. It's designed to make sure that people are not in a situation where they're uninsured for that time frame between employment with health coverage and Medicare. COBRA coverage can last up to 18 months, but in some situations it can be extended to almost 36 months. Each situation can be different. Again, if you enroll in COBRA coverage and you're entitled to Medicare prior to your employment ending, so say you are working, you become eligible for Medicare, you enroll in Medicare, you stop working, you enroll in COBRA. You can enroll in COBRA instead of Medicare, but keep in mind that COBRA is not considered credible for the purpose of delaying Medicare without penalty. So instead of enrolling in COBRA, honestly, you should enroll in Medicare in that situation. But again, the COBRA could be extended to a dependent or a spouse because they're not eligible for Medicare. If you quit working, you enroll in COBRA and then become eligible for Medicare, you should enroll in Medicare right away. If you don't enroll in Medicare right away when you're enrolled in COBRA and become eligible for Medicare, honestly, that could create some issues down the road because if the COBRA insurer finds out that you became eligible for Medicare but didn't enroll in it, you continue to use the COBRA coverage. If they find out you could have enrolled in Medicare, what they could do and probably would do is backdate your COBRA coverage to be canceled when Medicare could have gone into effect. And any services that you had COBRA pay for in the meantime, they will take back the money from the providers. So honestly, the best rule of thumb and my best advice is once you become eligible for Medicare, regardless of the situation, when you're enrolled in COBRA, enroll in Medicare. Your dependents and spouse can stay on COBRA if they need to, but whoever's eligible for Medicare should enroll in Medicare. There's very few situations where it would be a better idea to stay on COBRA. There's always exceptions to every rule when it comes to Medicare, and that's the same rule applies to COBRA coverage. COBRA coverage can be kind of complicated, and there are a lot of different scenarios that someone can fall under. I'm not going to go into all of them now, but I will say that if you find yourself in a situation dealing with COBRA, we do have some experience counseling people on COBRA and helping you understand your specific scenario, and we're always happy to help. So anytime you have questions, please feel free to reach out to us. In the handouts that I included in the email I sent prior to this presentation or that you received at a host site, there was a handout regarding COBRA and frequently asked questions as well. All right, any questions about COBRA? Not seeing any, I'm not hearing any, so we will move on to employer retirement benefits. So employers always have the option to offer healthcare benefits to their retirees based on whatever eligibility they may require. Retirement health benefits are becoming harder and harder to find, unfortunately. Most employers have decided to replace pensions and health benefits with 401ks or, that kind of thing. So becoming harder and harder to find, but there are still lots of employers, especially some of the larger employers, that offer health benefits for their retirees. And most of those employers offer health benefits that they have customized to coordinate with Medicare for those retirees that become eligible for Medicare. But again, keep in mind it's an option. It's not something that employers are required to provide to you. For those employers that do provide it, the rules are kind of out the window. So employers can pretty much choose whatever kind of health benefit they may or may not want to provide, whether or not it may coordinate with Medicare and how, whether or not it's going to have creditable drug coverage or coverage as good as Part D or any drug coverage at all. A lot of employers, and again, especially the larger employers, so if you are in Colorado a PERA retiree or you're a federal civil service retiree with FEHB, or you're a retiree from any of the larger companies like Hewlett-Packard or something like that, The larger employers do tend to offer options that are specifically designed to coordinate with Medicare for those retirees. Again, they don't have to do that. They can pretty much customize health benefits for retirees in any way they choose. A lot of them do choose to offer something very similar to the standardized supplements or advantage plans that you can go out and get on your own, but they will also customize them and enhance them and make them slightly better than what you could go out and get on your own. So, for example, PERA retirees are offered 2 advantage plans for health benefits once they become Medicare eligible, but those advantage plans offer better benefits than what you could go out and get the same plans or similar plans from the same companies on your own. So they offer enhanced prescription coverage through those plans. They offer lower copays. And employers can do that. They can make those benefits in any fashion that they choose. Some employers will simply choose to hire a third-party entity or a third-party company that is basically going to be a brokerage that will offer you standardized supplements or regular Medicare Advantage plans, but they'll be a little more limited in what they offer. And this third-party company will simply help you negotiate through the enrollment process. So they'll offer you comparisons of the companies that particular third party contracts with. So you may not get a whole list of all your options out there, but they'll provide you a wide variety of standard supplements and advantage plans, and they'll help you navigate through comparing them to see which ones might work best for you, and then help you enroll in those plans. Usually in that scenario, the employer, because you're using basically a brokerage to buy just something you could go out and get on your own, the employer usually incentivizes it by providing a subsidy to the cost of those plans or a stipend towards the cost of those plans or something like that. Employers could also simply say you're on your own and it becomes your responsibility to just go out and get whatever's available to anybody else out there in the world. Employers could simply continue to offer the coverage that they've provided you prior to Medicare, and that coverage would become secondary to Medicare and may or may not coordinate with Medicare and pick up any costs Medicare left over. So it can range from one extreme to the other, where employers could offer something very customized to work and coordinate with Medicare very well, or they could not, and then simply continue your current coverage and hope that it coordinates with Medicare. It may or may not, or any combination of any of that. So there's a lot of different ways employers can do that. What I do encourage people to do is look at any employer coverage that is offered, because 9 times out of 10, that employer coverage is going to be at least adequate and will coordinate with Medicare, or it will be enhanced and be better than what you could go out and get on your own to coordinate with Medicare. When you look at those employer options, if that's available to you, things that you would want to look at specifically is the drug coverage, for one. If the employer health benefit for retirees offers a prescription benefit, you want to make sure that that benefit is going to be considered at least as good as Part D or better. Employers are required to provide you annual notice, and we get these even though we're not Medicare eligible, every year as to whether or not the drug coverage available through your health benefits is considered credible compared to Medicare. And I know I get those letters from my employer health coverage every year. I'm not on Medicare or close to it. So it is required by federal law that employers provide that notice on an annual basis to tell you if their drug coverage is as good as Medicare Part D or not. You'd also want to compare the costs. So if you will have to pay any portion of a premium to have the retiree health benefit, you'd want to compare that cost to the cost of what you could go out and get on your own. You'd want to compare any copays that might be applicable, any deductibles or out-of-pocket maximums. And then the last thing you might want to look at is ease of use. Again, with Medicare as your primary insurance, Medicare is good anywhere in this country with any provider that takes it for any medical need, no questions asked. You get Medicare and a Medigap or supplement. Medicare pays first, the supplement pays second. You pay very little out of pocket. But if the employer is offering an HMO kind of coverage for retirees, absolutely you'd want to make sure that any doctors you want to keep or retain would participate in that HMO retiree coverage. You'd want to make sure that there are providers that you would use within the network or service area for that retiree HMO kind of coverage. So that would certainly be a factor that I would encourage you to look at as to what kind of benefit it is. You know, Medicare is a fee-for-service kind of option. Advantage plans are HMO kind of options, and whatever the employer decides to offer kind of option. I also have employers who offer health benefits that are Advantage plans. They're labeled as Advantage plans, but they work very much like Medicare and a supplement. So again, employers can make those options in any fashion they choose, but it's definitely an option worth looking at if it's available to you. We talk to a lot of people about their retirement health benefit options, and we're absolutely happy to sit down with you and kind of help you figure out how that works with Medicare and how it coordinates with Medicare and help you kind of compare the costs. And happy to do that at any time. But certainly if you're trying to do this on your own, just a couple of things that you'd want to make sure to take into consideration before you make that final decision on which direction to go. All right, any questions about any of that? Still not seeing any questions or hearing any questions. So let's move on to military. So I'm in Colorado Springs. Obviously, I'm surrounded by like 5 military bases. So we talk to a lot of military retirees. We talk to a lot of veterans. If you are retired military, meaning you have put in your 20 plus years and retired with honorable discharge, you automatically become eligible for TriCare For Life when you become eligible for Medicare. It is an automatic benefit that has been put into law for Medicare or for military retirees. TriCare For Life basically acts as a Medicare supplement, only better because it includes military prescription coverage or military pharmacy benefits. It costs nothing for the retiree and or their spouse once they become eligible in Medicare, but it does require that once you're eligible for Medicare, you enroll in Medicare in order to access it. If you do not enroll in Medicare, you could potentially risk losing TRICARE benefits altogether. The only exception to that rule is if you're a retired military, you're become eligible for Medicare, but you're still actively employed in the private sector. Again, you'd be able to delay enrollment into Medicare because of active employment with employer coverage. So you'd be able to delay enrollment into TRICARE. But once you're no longer actively employed and have that ability to delay enrollment into Medicare, again, you're going to need to enroll in Medicare in order to have TRICARE. If you are a retired military and you have access to TriCare For Life and you enroll in Medicare and you enroll in TriCare For Life, to be quite honest with you, you probably have the best coverage available in this country today between Medicare and TriCare. Those are benefits you earned. I always encourage you to take advantage of them. The only thing that you have to do, and quite honestly, the DEER's office for any branch of military is very, very good at providing written notice in the mail to people becoming eligible for Medicare, retirees becoming eligible for Medicare, up to 3 months prior to Medicare effective date. So they will provide you written notice in the mail that says, we realize that you're coming up on Medicare. This is what you have to do. And really all they require is once you enroll in Medicare, you give them a copy of your Medicare card. TriCare For Life goes into effect automatically. Again, there's no cost. It supplements all costs of Medicare, including your deductibles. And it includes creditable, which means as good as or better than Medicare Part D drug coverage. So again, if you're retired military, I strongly encourage you to take advantage of that. And unless you're working, you'd absolutely want to enroll in Part A and Part B to do so. If you wanted more information about how that works and what benefits are available, I've included the website for the TriCare webpage that takes you right to TriCare and Medicare webpage. It's actually a pretty good website. If you're not retired military, but you did serve, so you're classified as a veteran, and you already access VA services for healthcare. Eligibility for VA is based on whether or not you have a disability, or could be based on income, could be based on medical need. So there are different categories of eligibility for veteran services. VA for medical services and pharmacy services. And again, I do get a lot of veterans, and a lot of veterans ask me, I use the VA for everything. Do I have to enroll in Medicare? And my answer is always, probably. Again, any part of Medicare is optional. Nobody requires that you enroll in any part of Medicare. It's always an option. For veterans, the VA system is not considered healthcare. It's not health insurance. It's a health system. So if you don't enroll in Medicare, particularly Medicare Part B, when you become eligible, because you are accessing the VA, keep in mind that if you decide you need Medicare down the road, you'll have to wait for a general enrollment period, and there will be penalties involved. So I encourage people to take that in consideration and kind of nudge them in the direction of avoiding penalties. There are benefits to having both VA access and Part A and Part B of Medicare, because even though I live in an area where there are VA facilities, because we are surrounded by military bases, that is not the case everywhere. And VA facilities and the access to them is not always convenient. Whereas Medicare, if you have that as well, is good everywhere. So Medicare will always provide coverage for any medical need, anytime, anywhere. VA health benefits or health services could be tied specifically to VA-related health needs and may not always cover all health needs, may not always cover all medications for all health needs. So it does give a veteran more access to whatever health care you might need, anywhere, anytime, any reason. So absolutely a lot of benefits. And yes, you do have to pay the Part B premium, but if you access the VA pharmacy is considered creditable pharmacy. It's considered as good or better than Part D, so you wouldn't have to enroll in a Part D. You could continue using the VA pharmacy. You have the choice of also enrolling in a Part D if for some reason maybe there was a prescription that the VA pharmacy didn't offer or provide for, but that's a far and few between kind of situation. I rarely see that happen, but it's always an option. And if you chose to enroll in a Part D down the road, there would be no penalties because you have creditable drug coverage through the VA. Other advantages of VA, obviously, is going to be their access to long-term care services and support programs for in-home care and for facility care and for long-term care nursing home needs. So again, this is something that you earned. This is something that you should take advantage of as a veteran, but it is something that you have to think a little harder about when it comes to making that decision to enroll in Medicare or not. And typically, I'm going to encourage most people to go ahead and enroll in Medicare simply to avoid penalties. Even if you think you're never going to need any other health care anywhere else ever again, because you just never know what life brings us, there's always that possibility that you could be somewhere, you could be visiting family or on vacation somewhere and have a health need and not have a VA facility anywhere near you. And Medicare and VA do not coordinate with each other. They do not care what the other does. Very, very few circumstances where one even pays attention to the other, and that's usually going to be more or less an emergency hospitalization of some sort. Otherwise, Medicare is not going to pick up any VA copays. VA is not going to pick up any Medicare costs that Medicare left over. So they're two entirely separate systems that you use separately, but to have both of them opens up your ability to get care anywhere for any reason. More information would be available at the va.gov website. They actually have a pretty good website with lots of good information about Medicare and long-term care services. Any questions about VA coverage? Okay. Still not hearing any or seeing any, so let's move on to Medicaid. So Medicaid is kind of a big topic right now because the COVID pandemic is going to be officially declared over in the month of May. During the pandemic, Medicaid became much more readily available and widely available to many people, and it became continuous for people who were already on Medicaid when the pandemic started. Even for those people who became eligible for Medicare when the pandemic or during the pandemic. Typically, if you have been on Medicaid prior to Medicare eligibility, you have been on what is generally referred to as MAGI Medicaid, or Modified Adjusted Gross Income Medicaid, which is the expanded Medicaid benefits, or Obamacare is what it used to be called, that came into effect around 2014. For people who were on Medicaid prior to Medicare eligibility, typically, once you become eligible for Medicare, you are no longer eligible for that Medicaid program. You could still look to see if you're eligible for other types of Medicaid programs, but that particular program's eligibility usually ended because of the pandemic and the continuing Medicaid coverage during the pandemic. Many of those people were not dropped from Medicaid. They remained on that MAGI Medicaid program, even though they wouldn't typically have been able to do so. What that has created is a bunch of people who didn't enroll in Medicare because they had Medicaid. Why enroll in something that you have to pay for when you are going to be able to continue on Medicaid until the pandemic ends? Fortunately, Medicare and the government has been sympathetic to that problem. Not only was it something that people didn't feel the need to do, enroll in Medicare when they became eligible, but it may have even been difficult for them to do. So security offices were closed and getting through on the phone could have been impossible. The Medicaid office was closed to the public and getting through on the phone to them could have been very, very difficult. So even if somebody had tried to enroll in Medicare when they became eligible, they may not have been able to do so. Because of all of that, Medicare is going to allow people who did enroll in Medicare when they first became eligible in the last 2 years the ability to do so without penalty once the pandemic officially ends and their Medicaid ends. Now, the Medicaid benefit is going to continue for everybody until that person's annual redetermination period, their regular annual redetermination. What that means is if you enrolled in Medicaid in the month of June, every year in the month of June is your redetermination, meaning it's time for them to make sure that you are still eligible for those benefits. So in this scenario, what's going to happen is if you became eligible for Medicare, or you've been on Medicaid, MAGI Medicaid, you became eligible for Medicare a year ago, but didn't enroll. You initially enrolled in Medicaid in the month of June. Even after the pandemic ends, sometime in mid-May, your next eligibility or redetermination for Medicaid is going to be in June. You're going to be able to keep Medicaid until that eligibility or redetermination month. If your redetermination month is in December, you'll be able to keep Medicaid until December when you're redetermined. At that point, if you're no longer eligible for any Medicaid program, You're going to lose Medicaid, and that's when you'll have the ability to enroll in Medicare without penalty. So they've made it as easy and as painless as humanly possible for such a large government program to kick people off, basically, who don't qualify to be on it, but have been on it because of the pandemic. We have been working closely with our county departments of human services and the state, and getting the updates on a monthly basis from them on how they are going to manage that process, that transition for a lot of Medicare eligible people. And this is what they've basically come up with after several months of getting feedback and trying to figure out how it's going to be the smoothest transition for the most people. So we will be able to help people who find themselves in that situation. So if you know someone who's been on Medicaid, they lose the Medicaid, now they have to enroll in Medicare, we can help walk them through that process to make sure that they do what they need to do when they need to do it to avoid any future penalties, because they'll only have a 6-month window from the time their Medicaid ends to enroll in Medicare without penalty. And so the campaign right now is to make sure that everybody pays attention to what comes in the mail, because everybody will be mailed notices from the state about their Medicaid eligibility status. There's also going to be radio spots and probably TV spots when it gets closer to the end of May to try and make as many people as possible aware of what's going to happen to their Medicaid benefits potentially. So if you know anybody who is on Medicaid, make sure that they understand that they should be paying attention to anything that comes in the mail. And if they get something in the mail, they need to do whatever that mail suggests that they need to do. Ignoring the situation is not going to be to anybody's benefit, because it may be a situation where you'll fall through the cracks and your Medicaid will continue, but ultimately it will catch up. Medicaid will ultimately end, and you may be stuck without Medicare because you have to wait until the next enrollment period. And we would not want anybody to fall into that situation. Also keep in mind, there are lots of different kinds of Medicaid. In the state of Colorado, there are over 40 different Medicaid programs, and each program may have different eligibility criteria. So the other thing you'd want to look at is, even though you may no longer be eligible for the Magi Medicaid, you may still be eligible for some other type of Medicaid program, such as Medicare Savings Program, that will help cover the cost of your Medicare. Because every program has different income and asset limits or criteria, the system is supposed to automatically look at your eligibility for any other program anytime you redetermine or reprocess. But if you can be more proactive and say, I think I qualify for this program, now that I'm losing Magi, can you process for that program? That is always to your advantage. So hopefully not everybody will lose their access to Medicaid or their assistance in some form or fashion, but there will be plenty of people that do. And those are the people we absolutely don't want to have fall through the cracks and not enroll in Medicare when they should, because that, again, will cause penalties in the future and cause an extra delay in enrollment if they miss their 6-month window. So again, we're just reaching out to anybody and everybody to spread the word and spread the message so that nobody falls through the cracks. Again, people may still qualify for Medicare savings programs that we've mentioned several times over the past few weeks. Other programs that people may already be enrolled in or have access to through the Medicaid system could be the OAP program, which is a cash program that automatically comes with full Medicaid benefits. So even those people who become eligible for Medicare should automatically get all of that covered and paid for. Long-term care programs such as home and community-based services, where care comes to you in your home, assisted living Medicaid or nursing facility Medicaid. All of those programs come with full Medicaid benefits that would continue the Medicaid even once you become enrolled in Medicare. Even if you become enrolled in Medicare, keep in mind that Medicaid benefits, if you're able to continue them in any form or fashion, will no longer cover pharmacy drugs. So no matter how it pans out, if you're able to keep a Medicaid program of any kind, you still have to enroll in a Medicare drug plan. On the plus side, because you have a Medicaid program, that drug plan will cost you very little because you'll qualify for that extra help under Part D because of the Medicaid program. So the Medicaid is going to be a little convoluted for a while people are transitioning out of it and onto Medicare. There will also be other health insurance options that people will need to look at once they enroll in Medicare if they're not going to continue to be eligible for a Medicaid program. Again, we're always happy to talk to people on an individual basis about their situation and help them figure out what they need to do and when they need to do it. And so feel free to reach out to us if there are any questions that we can help you with. And I think, once again, I did include this handout in the email I sent to everybody that just kind of gives you an overview of the income and asset eligibility criteria for the Medicare-related Medicaid programs. Any questions about any of that? All right. We're almost done. So the last thing we're going to talk about is marketplace coverage. Again, this is part of the Affordable Care Act that provided private health insurance to all people all across the country, well, except for the states that decided not to participate, regardless of any pre-existing health issues. So this is federally mandated coverage. Throughout most of the country, the federal government manages a marketplace option for individual states, but Colorado opted to manage our own marketplace, and it's called Connect for Health Colorado. You can go to the connectforhealthco.com website, and it will give you the opportunity to enter some very basic information and let you look at all of the health insurance options available in the marketplace and compare costs and coverage and copays and all of that kind of stuff. It is basically private insurance for people who are otherwise not eligible for employer coverage or Medicaid or Medicare. This is an option. This is your other option for health insurance. By going to the Connect for Health website, in that situation, you can compare costs, including premiums, deductibles. You can also use that search engine within that website to determine whether or not you qualify for any of the tax credits or premium subsidies based on your adjusted gross annual income. But you are limited to when you can enroll in this kind of coverage to annual enrollment periods, unless you fall under a special enrollment period, such as losing other creditable coverage. For people who are becoming eligible for Medicare, so if you have been on a marketplace plan because you've been not working with employer coverage, but you're not yet eligible for Medicare, COBRA was not an option. You could have chosen marketplace coverage instead. If you have marketplace coverage and you become eligible for Medicare, your eligibility for marketplace coverage ends. The exception to that rule is if you have to pay for Medicare Part A, you would be allowed to continue with marketplace coverage instead of paying the premium for Part A and Part B. The costs are going to be probably pretty similar. But if you have to pay for Part A, you're not entitled to it at no premium. You could choose to use the marketplace coverage instead of Medicare. If you have Medicare, if you enroll in Medicare while you have marketplace coverage, technically you can do that. You're not encouraged to do that. But if you were getting any tax credits or premium subsidies, those would go away. And if an agent knowingly sells you a policy with the marketplace, knowing that you have Medicare, that's actually kind of illegal. They're not allowed to do that. So the bottom line is marketplace and Medicare don't mix. You can have one or the other. So typically, once you become eligible and enrolled in Medicare, you must terminate the marketplace benefits. The marketplace, though, is a good source to look for other types of coverage for people with Medicare, such as dental. You can search and compare dental policies in the marketplace. And they may expand that to include vision and other types of coverage. But right now, dental is absolutely a given, where you can just simply go out and buy your own dental insurance, and you'd be able to compare those options through the marketplace. The rules for marketplace can be a little confusing, but again, the bottom line is the best rule of thumb is if you have Medicare or become eligible for Medicare, you need to drop the marketplace and enroll in Medicare. Very, very few situations you would not want to do that. And again, it would not be considered creditable for enrollment, delayed enrollment into Medicare. So if you decide to keep the marketplace for whatever reason, and because you plan on enrolling Medicare later, there will be penalties involved. And of course, the rules and laws can be complex and confusing. So anytime you have any questions, when you have a situation involving marketplace coverage, you're always welcome to give us a call or reach out to us, and we're happy to sit down and talk to you about it. I did include a handout regarding Medicare and marketplace coverage, and I think it's a FAQ that might provide some additional insight. But again, if you have additional questions, you're always welcome to reach out to us. We're happy to sit down and talk to you. That's it. That is all the information I've got for you regarding Medicare. Well, technically not, but that's all I'm going to give you for 4 weeks. Again, we really, really appreciate you hanging in there with us for these 4 weeks, these 4-part series. Hopefully you found them helpful and informative. And absolutely, if you do have any questions or need any additional information, you're always welcome to reach out to us. We're always available to talk to you, whether it's by video chat, by phone, or in person. I put one last plug in to let you guys know that we're always looking for volunteers for the SHIP program. So anybody who might be interested, you're always welcome to shoot me an email, and I'm happy to talk to you about what we have available and how that works. And again, my contact information, shoot me an email. That's always the best way to get a hold of me. But you're always welcome to call because, again, we have a total of 5 full-time counselors and 2 part-time volunteers that should always be able to get back to you within a very short time. And with that, I will make one last call for questions, comments, or concerns, and we'll go from there. All right. I'm not seeing any questions. I'm not hearing any comments. So
Thank you, Roma.
You're welcome. Thank you guys. I appreciate you guys hanging in there. I appreciate you guys partnering with us. Hopefully we can do this again. And you know, I'm always available to come and talk to people on an in-person basis about other topics as well. So don't hesitate to reach out to me if you have anything specific that you might find of interest, or you have people in the community have interest in. I'm always happy to talk to you about what the opportunities are to talk about anything that I can talk about.
Thank you.
You're welcome, and thank you. So again, I hope you guys don't get too buried with the weather, but with that, I will let you all go. And if you have any questions, just reach out to us. We're always here.